We started the Hope Clinic in 2002, and it was the result of a lot of different, events that were going on, primarily the stress in medicine, the stress in commercial medicine. My husband, just from day one, we're not getting rid of the patient because the patient no longer is insured. We'll just work something out. So we were working something out, and it's sort of like every month that went by, it was a larger and larger group that we were working something out with. And that became a real challenge. And I mean, we had to, I guess you'd say, do some soul searching. What do you really want to do in this situation? And I think the thing that was hardest was being in conflict all the time. And it's like your insides are like always, you feel like you're going in to work and get your combat vest on because you're going to be dealing with insurance companies all day long, and it's going to be a struggle. There were a couple of things that pushed this over the edge to become a nonprofit. And one of them is a lady named Phyllis. She was 32 years old. She had 2 children and a very loving husband. She was uninsured. And Bill found a mole. She came in to have the mole checked on her neck. And she should have come in about 6 months earlier, because by the time the situation was brought to him, she was in stage 4 cancer. And so those 2 children lost their mother, and the reason she hadn't gone anywhere is because she was uninsured. And I think about Phyllis sometimes when I'm having a hard day or a tough day, is, that this is the right thing to be doing. And it's not always easy, but it is always the right thing to do. The Hope Clinic has served to deeply strengthen my faith. And I learned, I've learned a lot at the Hope Clinic. And one of the things is that you either trust God or you don't trust Him. There's not really a middle ground. And I'm sure, like a lot of people, there were areas of my life before I took on this position where I'd say, wait just a minute, Lord, I think I'll work on that for a while longer. And, I'm sure He's saying, well, go ahead, have at it, But I have learned at the Hope Clinic, just give up. Just let Him handle it. Do the best you can. Always, make the best efforts you can make, and He'll come through with a solution. If a patient wanted to come to our website, I would just want them to know that the honor is to us that you are allowing us to take care of you. We feel that anytime a patient walks in your door, they are trusting you. And whenever someone places trust in you, that they're honoring you by doing that. And we're honored that they place that trust in us. We do have patients that we have a significant number of patients that we've had over 30 years. And there's really not any way to take that but as a compliment. So we will listen to all of your symptoms, not just some of them. We may not be able to deal with all of them at one time, but they will all be dealt with. Last year we gave just over $700,000 of uncompensated care. That's at primary care rates, which are pretty low. It takes a lot to get to $700,000 at $40 a clip. It's a long way. And we're very pleased to do that. We think that helps to stabilize the society that we all call Gwinnett County. And we think that building kindness and right behavior into the structure of how this society works will benefit our children and grandchildren for years to come. If you're going to try to help the less fortunate, and you have a heart for that at all, do you want to send your money to a government organization, or would you like to give private, nonprofit Christian healthcare a chance to use your medical dollar to help someone else? Hope means, to me, it's when eyes light up and people can see that, wow, maybe I'm just not always going to be this sick. Maybe I have a chance now. And I think that's the thing that is the most thrilling, if you will, to see at the Hope Clinic, is when people just start to realize, okay, these people really do care. They're not kidding, they care. And they know because they're followed up with, they know that, connections to other doctors if they have to be hospitalized. All of those things we're there for them.